Welcome, welcome. Gosh, what a great group. This is lecture number 11, can you believe it? Many for change. And I have some really fun slides to show you before we get to going with Dr. Doraiswamy. So, a number of you were at our potluck party last month. And just to tease your memory, look at that, wasn't that gorgeous? We had this crab sushi appetizer by Sheila. And then a lovely salmon mousse with jicama and cucumber slices. I think that was by Harriet. We had Tracy's very own delicious watermelon salad with feta cheese and fresh basil. This is almost a surreal picture. It's like a floating glass bowl. It was heirloom tomato salad, just delightful colors. And this was like almost, I couldn't get all the foods, but quite a few foods on one plate, and it was just so appetizing. But not, to lest we forget, there was dessert. Someone in the audience made dessert. Look at that gorgeous presentation. It was just delightful. Roasted strawberries over Greek yogurt. But what you may not know is I've been working on a cookbook, a recipe book from the event, so that's coming out soon. We can see all the photos and all the recipes, so yummy. But Dr. Vinod Doraiswamy, one of our allergists here at Pollen Clinic, is here to talk about food allergies, and it's a very interesting subject and fascinating as I think about different foods we're eating and whether we're reacting to them or are they helpful for us, and kind of questions that come from that. So I'm going to just step over here and flip over to his slideshow, and please feel free to ask questions as we go along.
Good evening, everyone. So thank you, Susan, for having me over to give this talk. And it's a small group, but interesting and interested group. So, and my intention today is, again, talk about food allergy, and if there are questions or concerns, please don't hesitate to just stop me. And this should be more like a two-way. I don't like the lecture. This is kind of more like a discourse about trying to understand this very important topic, as Susan mentioned. So, the idea is, in a nutshell, there are lots of different things. What you're here, hopefully, to learn is, again, what is food allergy? How do we go about, finding or diagnosing allergy? What are the symptoms of allergy? What tests are available? And how do you treat? And what are other new things on the horizon? Bunch of cases we can talk about. Let's not go through the list. I'll go through them individually, after we kind of talked about it. Again, food allergy, if I have to step back and, this is the official diagnosis, whatever the statement as to what is food allergy. But food allergy is a very common term that, is used. And a lot of times it's used incorrectly. Food allergy means, it's a very broad term. Food allergy to an allergist is different than a food allergy, say, to an individual or a patient. And in general, the feeling is there's something with the food. There's something that, that doesn't agree. Either it's you, or it's the food, or something, the interaction, there's something happening. So, but the true definition as an allergist, what look at food allergy is there's a specific immune response. So the thing that separates the true food allergy, what as allergists we practice, is there is something happening with the immune system that kind of causes you to have a problem with that particular food. And it happens reproducibly. It happens every single time you eat that particular food. So this is the definition that came up with new guidelines from the National Institute of Allergy, Immunology, and Infectious Disease at NIH in 2010. Again, we're talking true food allergy, which is the immune response and the reproducible response. But 6% of kids, 4% of adults, there are a lot of people who do die from the food allergy. And of course, there's been increasing allergy over the last 15, 20 years. That's a whole different discussion as to why that's happening. So, in a nutshell, food causes symptoms. It happens every single time you eat the food. And if you're not, and you don't have the symptoms if you don't eat the food. And of course, testing is there that can show the allergy. Again, if somebody wanted more pictorial, when we talk of an immune response, we have what's the allergy cell, and there's the antibody, what we call as the IgE antibody. We'll talk about antibodies in just a bit. And if you're, not everybody makes this. There are only certain people who make those allergy antibodies. So majority of the population probably don't make that. So if you do have it, it's kind of bound to the allergy cells, and these cells are found pretty much, all over your body, in your skin, deeper in the tissues, but also in your nose, throat, lungs, intestines. So if you're allergic, it gets recognized, and the process of where the chemicals gets released causes the symptoms. So you can, just as I mentioned, those are the places you find the cells, so typically you can find symptoms in those areas. You may or may not be able to see it with the light. Again, hives on top, swelling, is at least can be detectable, but there are other symptoms that can happen that, you don't really have. I don't think it'd be too much fun showing a picture of diarrhea. So you could have some throat tightness in the throat, you could have some difficulty breathing, coughing, voice change, drooling, vomiting, cramping, diarrhea. You could feel dizzy, lightheaded. If you're turning blue, it's pretty late, I would imagine. So, and you can be confused. There is one thing that some patients describe who are truly allergic is, I know something's bad's going to happen. I think I'm going to die, almost. So it's kind of it's an indescribable feeling, but patients who have had allergic reactions, know that there's something not right, something terrible will happen. What foods? Again, in terms of allergy, more than 80% of allergies in general are caused by the top, these foods: milk, egg, nuts, seafood, soy, meat, and others form the small, pretty much, a lot of you probably, heard or hear quite often strawberries, a lot more, but it's not a major allergen. There are avocados, kiwi, lots of different other foods, make the small, amount of allergens, or not many people have that. How do we test? How do we figure out? The key is it requires pretty much all three. As an allergist, my day-to-day, job with food allergy is, trying to find out what happened. I think, more than anything, more than the latter two, more than testing, the first is trying to figure out what, what foods did you eat when the reaction happened, and what was the setting, and also, before and after, trying to figure out what the pattern is. So the key thing here is not the testing, the key thing is what the story is. And then you do have the testing. So the testing, skin prick testing. Any of you have had allergy testing? Okay. So what it involves is we have either plastic devices with the tip needle, and either what we call is prick the top layer of the skin, and this is dipped in an individual allergen, or there are various different devices. One's plastic devices where you scratch the skin. Basically, what you're trying to establish is the cell, as I showed you, does it have the antibody? And if you're allergic, generally you have kind of a local response, and the response is fairly immediate within 15-20 minutes. And it's a pretty sensitive test. When I say sensitive, from the medical, language, but if we put it simply, if you're allergic, the skin test is more likely to find it, as opposed to blood testing. So, but with food allergies, sometimes it so happens for whatever reasons it may not be found in the skin. Sometimes it's found in the blood. So I usually use both skin testing. If skin test is positive, then usually there's no reason to look ahead. And if it's not, then I look at the blood test, and if that's negative, then the final test is we do what we call as a challenge. We have the patient bring in the food and have them eat the food and see what happens. Because with both testing, depending on the food, there's about anywhere from 10 to 40% likelihood that one could be allergic to it. Remember, again, I just have to remind, saying when we talk about allergy, we're talking of people having those symptoms. We'll talk about other, food intolerances or sensitivity, but when we talk about food allergy, there's that story or history saying they ate a peanut and they had hives in the face, or they had fish and they got dizzy, like maybe had vomiting or diarrhea. Then we'd say, if you do the test, if it's positive, then are you going to go further? One of the things as an allergist I do is understand the limitations of the testing, which is, I try and limit the testing to what's needed. So I don't usually test for things that people are eating fine. So if they say they're eating, dairy or eggs fine, and the reaction happened and they're eating fish, then I usually don't look at dairy and egg, I only look at fish. Because as we know, when you talk about food allergy, usually if you're eating the food and eating it fine, that's kind of makes allergy unlikely. But if you're eating, then as I mentioned, the story would be trying to piece down or nail down, saying what are the potential foods, what are the likely foods that may cause the allergy. All right, so this is with the NIH guidelines. There's lots of other tests available, and when somebody is having these kind of allergic reactions, there's not been shown to be, any strong scientific data with regards to diagnosis of allergy. So, and typically these tests are not covered by insurance. As just on Kira and Tracy, there's lots of tests available, and I'll kind of touch on that at the end of the talk. What's the treatment in terms of food allergy? You'd say avoid. Unfortunately, there's no treatment. Although there's some, when we talk about future treatments, there's some potential treatments of feeding these immediate kids who have allergies, the particular food they're allergic to, and has been shown to give some promise in terms of preventing, allergic reactions. But still, it's in research, still experimental. You avoid foods, you read labels, you avoid kind of cross-reactive foods, trying to understand, so as an allergist, we have an understanding as to what potential foods could kind of react, and, sometimes, for example, people are allergic to peanut, at least as kids, we ask them to also avoid tree nuts, just because, not that they're related, but they're kind of processed in the same machines, and quite often I tend to see, kids, say for instance, who was allergic to peanut, have a reaction to the almond butter. Not because they were allergic to almond, but the small piece of peanut that got in there and they had a reaction. And it's always, tricky, when you're having foods processed on the same equipment, especially with nuts or dairy or other stuff, there can be small amount of food that you don't recognize that could cause reactions. Because yesterday I had a mom who said, she had a reaction to walnut, possibly she never ate nuts, and her grandma got toffee from California, and she ate a toffee and she had a bad reaction, saying, there must be something in the toffee. I said, well, it's probably a salted toffee, possibly there's some nuts somewhere. And of course her testing was only positive for nuts. It's not like she was allergic to the toffee or the caramel, not that we tested for it. But the feeling is it's very likely a contamination reaction.
But I'm curious,
Yes, Susan.
I'm curious. Often on packages you'll see, in very tiny print, processing the facility, but also processes blank, blank, blank. Is that a regulation, or is that just a courtesy, or just thinking about the industry and manufacturing?
That's a great question, because I think one of the problems in the last decade has been lack of adequate labeling. So there was a act that Congress passed in 2006, if I remember, is where there's been labeling of products. So I think it's required that, they label the major ingredients, which is the major allergens, and also where it's processed. So one of the things you're never gonna get is if it's a minor ingredient, that never gets labeled. With the labeling, one of the things that gets missed as allergists that we have difficulty is a lot of product that has natural flavors, you never know what it's made of. So it could be soy lecithin, for some reason you would not know that, because those are all proprietary and you never can get that information. But it's helpful in the last few years that there's been good labeling overall. Unless, of course, products manufactured outside the country, then probably they don't necessarily need to meet the stringent, criteria. So avoid, kind of cross-reactive foods, reading labels, being aware when you're eating outside, because, one of the things is when you're eating in a restaurant, you think you're getting the food, but you never know what exactly you're getting on the plate. Say, for instance, have kids with cashew allergy or tree nut allergy, they may go, they may tell the waiter, they may tell the restaurant, well, he or she is allergic. What might have happened is the previous or the next table where somebody else might have ordered cashew crusted chicken that got, grilled in the same, on the same place, while the child's, was also done after that. So sometimes contamination happens quite frequently. I hear it all the time, when I've had kids with peanut allergy, they go to Asian restaurants and they say, peanut allergic, and this mom came in and said, when they ordered egg roll, it had chopped peanuts in it. So that's obvious, but sometimes it's not so obvious, it's in the sauce, you never know that. Yes?
What's the beta blocker?
Okay, great question. So I went back. So when you're allergic, when you're known to have, when you're known to have food allergies, the treatment, as we'll talk about, is, epinephrine or the auto-injectors, epinephrine injectors. And the way the medicine works is you increase your heart rate, increase your blood pressure, kind of tightens up your blood vessels, reverses pretty much all the processes that's happened in an allergic reaction. Most of that happens through, a receptor in the body called, beta receptor. So if you have high blood pressure or heart disease, then one of the medicines that are people using is beta blocker to kind of, decrease the blood pressure and, or manage the heart and do the heart rates fast. So if you're allergic, either a food allergy or if somebody's allergic to, say, insect stings, they've got a bee sting allergy, it's important that they talk to their doctor and say, maybe you should not use a beta blocker, probably use a different. Why? If you do have a reaction, I give you the epi, it's not going to work because you have something sitting there preventing it from acting.
So is over-the-counter allergy medication interfere and beta blockers, are they contraindicated then?
No, they're not. Allergy medication and beta blockers have nothing, they don't have any interaction. It's that, it's that if you have a reaction, the epi won't work. So you cannot, you cannot be successfully treated. It may work to some extent, not fully, but certainly potentially it's like when it could be fatal, just because the medicine most people would use to treat a reaction won't work. So I kind of remind my patients to say, talk to your doctor and say, maybe you should probably not, use an alternate medication. And vaccine, we can touch on vaccine allergy. For food allergy, then there's certain vaccines that contain a food protein that you could be allergic to. So, talking about the case, so here's, some of you have probably run kids, so 15-month kids or grandkids, so 15-month-old girl. So she had hives after she had coconut shrimp. Next day, again, after tilapia, coconut sesame oil, soy sauce. It's just to illustrate to say there's so many things happening. How do we know which one it is? So I think that is where the importance is trying to figure out the story. And so going back and forward, trying to figure out what potentially could be. And here's a young gentleman who, after eating pizza or sandwich every single time, would have tired, fatigued, have some belly discomfort, diarrhea, and he has been diagnosed with IBS. So it's interesting, a lot of times they do see, IBS, that's not food allergy, but in this instance, it so happens. The first one, she was allergic to, fish and shellfish, so allergic to both. And with the second one, he had some environmental allergies, but also he was allergic to a lot of gluten foods. So it doesn't happen too often, I would say. He was truly allergic to, malt, hops, oats, barley, and subsequently also nuts and soy, and he took out, again, I referred to his name, doesn't happen too often, where you see wheat allergy, when you look at percentage, probably about 2% of allergy, so it's not as, common. Wheat intolerance is probably a lot more common. But this young man took out all of that, and most of the symptoms, all of the symptoms went away. So here's 61-year-old who has throat swelling after cantaloupe, avocado, kind of fruits. So there's this allergy called pollen food allergy syndrome. So she had a lot of pollen allergies. She had testing to foods. So there's, if you're not familiar, maybe busy, but pollen food allergy syndrome or allergy syndrome is a condition, allergy condition that we tend to see. People who have really bad allergies, when you say allergies, really bad hay fever, runny nose, sneezing, congestion, itching, they're, again, springtime or fall, they have a lot of allergies. So birch is a tree pollen, mugwort and ragweed are weed pollens. So people who are allergic to certain pollens, then pollen's of course a tree product, right? And then there are certain tree products that people become allergic to because the protein is common. And usually I don't tend to see, not everybody who's allergic to pollens has this allergy to foods. Usually my experience has been once they've had pollen allergies for a while and it keeps on increasing, that's when I tend to see this. And the key here is, usually they experience kind of itching in the mouth, the throat itching. Sometimes, I've seen where it's just plain bellyache, IBS kind of symptoms. So I think it's interesting. There are some who have this IBS, are later found out that they probably have kind of pollen food allergy syndrome. Rarely, this can progress to anaphylaxis, which is a severe allergic reaction. And in general, people who eat raw parts, raw have problems. If it's cooked, it generally is okay. So, the bad part about this thing is we make people from being healthy to unhealthy. We say, you can't eat apple, but you can eat apple pie. And not everybody's very different from what foods trigger the symptoms. There's also, again, as an allergist, is understanding, trying to figure out if you're allergic to peach, then there are other foods that you could be allergic to. Same thing with cantaloupe, so we see avocado or kiwi, allergy. Again, related, people who are allergic to latex, have issues with certain foods. Again, similarly. And there's this whole chart. Not that I can memorize this, I have to always look at this sometimes. Just to have to point out, if you're allergic to fish, very likely you're allergic to most fish. That's more than almost 50%. To shellfish, because the question I get asked sometimes is, I'm allergic to shrimp, but can I eat crab, or can I eat lobster, or can I eat mussels? And I have to say, there is some difference in patients that I see who may be okay with, say, the shells, which is the mollusks, which is clams, oysters, and scallops, and mussels, but not okay with crustaceans, which is the shrimp, crab, lobster. There's some who can do that, but usually the feeling is if you're allergic to one, then they share a common protein that you're likely allergic to most of them. Same thing, again, with melon, pretty much high. Interesting question sometimes I get is milk allergy. If there are milk allergy, it's usually any mammalian milk you're allergic to. So you can't try any other milk. And the only milk, I think, showed there is a mare's milk, if you can go milk one. So there was this gentleman who came in, he had hay fever, he had eczema, and he had, milk intolerance. he thought maybe shrimp and red pepper was causing the rash, and testing showed that he's dust mite allergic, and dust mites do play a role. These are teen bugs that you can't see with the naked eye. So it cause a lot of other allergy issues, but also can contribute to eczema. But he turned out that he was not milk intolerant, but he was actually allergic to the milk. So he took the milk out, and most of his eczema went away. So just to back up and say, what is, again, eczema is the skin condition where you have, I don't know if you can see, dry, really scaly patches. And eczema tends to be primarily a skin disorder, a kind of immune disorder. There's porous skin, it loses moisture, it doesn't have natural oils, plus also the immune system kind of gets riled up, okay? It kind of causes more irritation, inflammation. But about a third of people with eczema, especially more kids, probably can have allergies, food allergies that can trigger eczema. And they, I see, even just yesterday, one of my patients that had it, he had his 9-month-old, he had really terrible eczema, but we found out that mom being breastfed and the mom who is getting allergies to, he was allergic to nuts and eggs, and once mom took it out, his eczema is 90% better. So it does play a role. Again, it happens a third of the time. Most of the time, there's not an allergy issue. Okay. There's this newly described condition called eosinophilic esophagitis. It's a mouthful, but so there is this woman I was going to talk about. So she's 47. She kind of chokes on foods. Heimlich, there are lots of times in restaurants where people have had to kind of relieve her of the obstruction. She has allergies. She's got asthma. She's pretty allergic, individual, and she thought she had allergic reaction to calamari. So when we did testing, she was fairly allergic to environmental allergens, but she was allergic to quite a bit of foods. And so when she stopped eating those foods, we had seen her about 3 months later or so, most of the symptoms had gone away. So, and she came with her mom. She was 47. Her mom was like 80, I think 85, and she was talking about. I know why ever since a baby she always had trouble with food. Every time she would kind of vomit, every time she would have, she would actually things down. And both mom and, both her and mom would say, this is the first time that she's really felt better when she's taken those foods out of her diet. So this condition, what's called eosinophilic esophagitis, this is allergic inflammation. The left shows, food in the food pipe, right? And also there are changes that happens that people are more, as gastroenterologists are able to recognize more as suggesting this condition. There are things that happen in the lining. There's a lot of these allergy cells that come up over there. So a lot of times people have narrowing in the food pipe, the choke on foods. And the current feeling is if they're allergic, what they're allergic to in the environment and what they're allergic to the foods is likely what's causing it. And if you can identify and take those foods out, most of the condition will get better. Easier said than done. Then you can usually, like we find in medicine, a lot of them is multiple reasons, at least. But a lot of people, we can find something they're allergic to and they do get better. Okay. Again, medical term, they carry angiodema, simply, the common words would be hives and swelling, and so there's this woman who came in to me, she was 71, and she had some lip swelling, she had some itching over heads and ankles after she had salad with salmon and walnuts. So, and we did the testing, I think she was somebody who was probably, doesn't eat walnuts all the time, doesn't eat salmon all the time, and we did the testing, it was negative, then both skin and blood, then we did the challenge individually, we did the salmon, she did fine, and then she introduced nuts, so, she didn't really have, so she came with the concern saying that, something caused me to have a reaction, and it turns out, it has nothing to do with the food. There's this condition that people can have hives and swelling, and that's and can happen from lots of different reasons. Sometimes, most of the time, we don't know why. Sometimes it's very brief, but also can last, months and months or years. But she didn't have something that with her aunt was lasting that long. Okay, so vaccines, so people who are allergic to eggs, if you have a flu vaccine, is made in chicken eggs and certainly, can cause reaction, but more and more, manufacturers are more aware of it, that they've kind of lessened the egg content and generally tends to be safe, but we still do it under observation, which is we give the vaccine, we watch for about 30 minutes or so, make sure they don't have a reaction. There have been an occasional instance here or there where I've had kids who have received the flu vaccine that have had really large local reactions, so we have not, given them the vaccine. So it does happen, so depending on the allergy. So to understand how allergic the individual is before deciding if and when to vaccine, but most people can get the vaccine safely. And of course, if you're traveling to Africa, would be yellow fever vaccine, would be another one. So gelatin allergy, again, there are is commonly used in certain vaccines, so being aware of saying if you're allergic to gelatin, there could be other vaccines that one could be, potentially having a reaction with. Okay, so, food, like I mentioned earlier, I was trying to focus mainly on food allergy. So there are other food sensitivity or tolerance, lactose intolerance or celiac disease and GI symptoms. So I just kind of put it together because that's typically, again, not an allergy. We don't when we do the testing, we don't find something that's usually positive, but it depends on the individual, depending on whether they have allergy or not. And a lot of times I get asked questions saying, every time I drink milk, of course I feel terrible, right? Or every time I have yogurt, sometimes I feel terrible, but my allergy test is negative, so that's perfectly fine because, when somebody's allergic to or somebody's sensitive to the sugar in the milk, and then you can't digest that, then, the allergy test would be negative. But food is still a problem, so, you still avoid, milk, or you can kind of minimize to how much you can tolerate. The thing about lactose intolerance is some people are born with it. They're from the get-go, they're usually intolerant, but a lot of times people get lactose intolerance in their adult life very commonly. And quite often happens with, if they've had a travel, they went to Costa Rica, then they had a bug, then they find out that I can't handle milk anymore. So that's a common scenario where it happens. But the treatment, of course, is trying to figure out how much you can handle, or maybe lactose-free milk. There's stool tests one can do to see if you're not digesting. There are other tests like breath tests that one could do to diagnose lactose intolerance. Celiac disease, which is again gluten. Again, their gluten sensitivity or gluten intolerance. But when people, with celiac disease, which is an immune, which is a immune condition, the body's intestine doesn't like, wheat or any kind of gluten. It's the certain protein in gluten, and it causes kind of changes in the intestine that you end up feeling bloated, gassy, diarrhea, kind of, mainly gastrointestinal. Some people can have, a rash on the skin that can come up. It can be easily missed sometimes. So, but this is the testing that I do. This is testing, blood testing that would be negative. When somebody who's got celiac disease, but still it's a problem. There's a blood test available to kind of, certainly screen for that. It's pretty good, but the best test generally is, seeing a gastroenterologist and getting a biopsy done. And if it's shown, then, you will go and kind of avoid gluten for a long time. The key thing to remember when you're doing either the blood test or the biopsy is you're not avoiding gluten already. If you're already avoiding it, then there's no reason to test. Usually it tends to be negative. And I do get a lot of patients, who have, saying, I'm tired, I'm gassy, I'm bloated, cramping, maybe I always have diarrhea, always, either constipated or diarrhea, so, kind of what, as medical field kind of labels as IBS or irritable bowel, I do get a lot of that. And I do look for food allergy, again, if there's they're allergic. Sometimes we look at, again, to say, is there something that we're missing? But generally, it's not something that we find either from skin testing or, blood testing. So, and that's one of the limitations that, we have. Oh, sorry.
Can I ask a question?
Yes, Kira.
Can you talk about how GI bug might induce lactose intolerance?
Okay, so if you get an infection, then it kind of settles into the lining of your intestines. Kind of there's you can lose part of the lining. There would be damage to the lining. All the sugar digesting enzymes are in the lining, and sometimes they don't get replenished. So then you end up not able to digest sugar for varying periods of time. For some reason, it becomes more permanent. Again, I guess we don't understand why that happens, but but generally it tends to be temporary. I don't think there's enough data to say, well, during the time if you keep eating lactose, would it make it worse? So you don't want to do that because you're going to be paying for it. So okay, I think this falls into Kira's world in terms of IgG food allergy testing, and I get a lot of patients who have had food allergy, the IgG food testing, and I have to say it comes a lot more. If you can use the word really sexy charts, it becomes really nice, much more pleasant and much more informative. When you look at it in terms of the numbers and the graphs and everything, as opposed to mine, testing it's on the skin. And even the reports too that they do for the IG food allergy testing is just plain numbers, nothing that seems striking. But you do get this chart, maybe if you have to say something in common, saying you get this high numbers, and I don't do IgG food allergy testing because for one, it's not covered by insurance, and it's pretty expensive. Second, I think you're learning more about IgG food allergy tests as to what it means. The medical community is kind of looking into it. There's been some, when I've looked at literature, there's been some papers that have kind of looked at it. The key thing with most of the studies has been, based on testing, people have avoided, say, wheat or gluten and dairy, and then it's shown that it's, they're a lot better, which generally tends to be the case because wheat and dairy tends to be a very, big part of our diet these days, that when you kind of minimize, generally you do feel better. So that one can, to some degree, possibly predict without testing. But, there's all these other foods, why they come out positive, or what the number means, I'm still yet to know, unless you have some information as to what those numbers mean. Because when we do the blood testing for IgE, they have what we call as a unit. They have a quantification saying so many, any substance, so many units or so many milligrams or micrograms, so trying to identify what are we talking about. So do you have information as to what those units mean, if at all? Do you know when have these numbers? What are those? Do they have a certain designation?
It seems that every lab has their own numbers.
Yeah.
They probably mean different things for different labs.
Correct. So again, that's one of the things is there are different. Each lab has their own, and results from one lab is not the same as results from the other, and you can't really contrast and compare the two. You've got to be, and even what's been the experience when you order from the same lab? Do you get fairly similar results?
On some foods, I get surprisingly high numbers. For example, so as I was saying
I know you mentioned it just before,
I've been
so.
watching for those foods, but no, they definitely change from person to person.
I have to say, most of the time when I have patients come in, when I see it, a lot in the dairy, most of the cheeses come up positive. Of course, gluten tends to be positive quite often, then for some reason asparagus, I don't know if it's positive here, but I see that banana, I see that quite often. So there are things that come on and off, and of course, I have to say, you do get a good chart as to saying which you're reactive to, which you're not reactive to, and then you also get, a good, again, some of the labs have their own diet and stuff like that. So as an allergist, my approach to that is we don't know what they mean, what they are, but if I take you back, in terms of food allergy, you'd say is the key thing is the story, trying to figure out, what's happening. So a lot of other non-allergic, symptoms, the best thing you can do for yourself is probably keep a food diary, it's more so because so you can kind of, the power is in you, so you kind of monitor your own diet, kind of see how you feel, and if you feel there's something that always tends to bother you, maybe there's something to it, So I have to say, as an allergist or something, there's not a test that somebody can do and say, yep, here, this is what you're allergic to, because it's a two-way street. It's got to be you put in the setting along with the testing. The testing doesn't stand by itself to a large extent. So I think keeping a diary, monitoring it, if there's a problem with a particular food, again, you avoid it, then you put it back, avoid it for a certain length of time, depending on the condition. I guess it varies. A lot of times when I see people who do that, they don't do it correctly. They kind of take away all the foods and put them fairly all one together, back to back together, that then you don't know, what you're allergic to or what's causing symptoms. So you want to do it in a systematic manner. So I know Tracy and, Kira and work a lot with that. So I think talking to a nutritionist and will be very beneficial, in terms of having a program or a plan of, avoiding foods and putting them one by one back into your body, trying to figure out what's causing it. Okay, so of course, food allergy is common. Diagnosis is not straightforward. Accurate diagnosis, which requires, as I said, more than just testing, and reactions need to be correctly treated. What I didn't focus a whole lot today is, treatment. The treatment for a food allergic reaction is that epinephrine injector. It's really important. You should not, if somebody is really allergic, you should not hesitate to use it, no matter what your age is. There's concern if you're elderly, you could have a weak heart, should we use it or not? But when in the context of what we're talking, saying food allergy, you're allergic, you ate a food or likely ate a food, you have a reaction, should use the epi, because people can die from a food allergic reaction. People do die from a heart attack during a reaction, so the medicine doesn't make it more likely for you to do that. You should say reuse that. Okay. Sorry, I'm a few minutes late. Thank you for your attention.
So I know a couple of you have to leave. Thank you so much. That was so helpful. And if there are any questions afterwards, please feel free. I actually had a question. You mentioned about food intolerance perhaps developing later in life on occasion. I'm wondering if there are people who are not allergic to allergy when they're younger, but actually develop an allergy later in life to certain foods, or if there are examples.
That's a very common question I do get asked, because sometimes I see a 30-year-old or 40-year-old, and just yesterday or early in the week I had an individual, he's 39, and he had a handful of pistachios, and he had pistachios the previous day, he was okay, but the next day he had like 2 or 3, and then he had immediate within like 10 or 15 years, he said he had that, then he was talking on the phone to a client, then he had to stop because he said he couldn't breathe, he couldn't talk, put the phone down, then he had guests in the home, he said he played low key because they were cooking dinner, so he took Benadryl, then he laid down, but after 20 minutes he was feeling really terrible, he couldn't breathe, then his wife drove him to the emergency room. So when he went there, of course, he had hives all over, he was really red, and he was swollen. They gave him epi, which sometimes in the emergency room doesn't happen even in the emergency rooms these days. Sometimes probably, I don't know why, but he got it. He got other medicines too, but within 2 minutes he was almost better. And by 15 minutes he was pretty much back to normal. So that's an example that says, yeah, he had a reaction, meaning he was eating a food, he had symptoms right away, he got the treatment that one would give for a food allergic reaction, he got better. And when I seen him, this happened just 2 weeks ago, and when I seen him earlier this week, his skin testing for pistachio was positive. Again, we looked only at peanuts and tree nuts. He does eat peanuts, his test was positive, so again, one of the things with food allergy testing is it could be false positive. So how do I know with pistachio is it really allergy? So we could go the next step and have him eat it, but the feeling is if one time that's all he ate, and then he had a reaction bad enough, they'd probably go to the emergency room. Best is, that's very likely what caused the reaction. So it does happen. So it was the same question, saying, I've been eating it on and off throughout my life. Can I, how do I get it? And it's hard to know why that happens, but it does happen.
What about to piggyback on that question?
Yes.
Do you see food allergies resolving, or is a person sensitized to that?
So it depends on the allergen. So it depends on the food they're allergic to. So there are certain foods, nuts or seafood. The feeling is it's probably a lifelong allergy. Milk. Kids I see milk and egg allergy all the time, and most of them outgrow those allergies. It just depends on the food. The treatment, of course, is avoiding, and the feeling is you avoid long enough that you're likely to outgrow. You don't avoid, it's unlikely. You keep your body sensitized that you're not going to outgrow. So the reason I tell the patients to avoid is not necessarily not to have a reaction, but that you avoid it long enough that you outgrow. So I do, there are so many kids that I've seen, they had a reaction, say, to a peanut in the first year or two, then they avoided. A couple years later, they're actually, we have done testing and they've been negative, and we have had them come in and do the challenge. We've fed them peanut and they're done fine. So they're back eating peanuts now.
What about adults?
Yeah, adults would be, similar. Again, probably, there's a lot more instances in kids because those allergies are a lot more common. With adults, if you've had allergies, I do see adults who have had allergies since they were a child. Those probably never outgrow because they're already like 25, 30, and they're still having reactions. But there are a few who have, who had reactions a long time ago who can eat it.
This isn't really food allergy, but
Please.
similar question. So
Please.
with environmental allergies, I see those change over the course of a lifetime too. And why is that? Because you can't avoid it completely.
Yeah, meaning I think we change through the years. Our body changes. We are not the same what we were last year. We are not the same what we were 10 years ago. And there's so many changes that happens, to us, to the environment, that everybody's allergies, it's kind of hard to predict. But in general, there's, people who have really bad environmental allergies, there's allergy shots that can kind of take care of them, right? So, and those are really successful and really helpful. But to answer your question, we don't know why that happens. It's kind of hard to predict. So if somebody comes in today and says, I'm really suffering, do you think in 5 years I'm better? It's kind of hard to know. Did that answer your question? Yeah. And in women, I think it's a little bit also, pregnancy can change a lot. So I see quite often, people with environmental allergies who didn't have allergies, and after they've had the baby, they have really terrible allergies. So
menopause too.
do you? Okay.
That's me.
Okay. So now, hormones, do affect, and the thing with food allergy, which again goes to saying why would anybody develop food allergies later on in life is, again, maybe something changes in our body, in our system that makes it more likely. There could be times, you could eat the same food, may not have as much of a reaction, but sometimes even a little bit can cause, pretty bad reaction. And it's unpredictable to some extent as to why that happens. There are lots of other mitigating factors, lots of other factors, the time of the day, what you're doing that day, how has your life been, what's been personal stresses, or do you take other medicines or alcohol, did you work out that day? So there are lots of things that can affect if and when you do have a reaction. So it's not fairly straightforward.
Thanks so much.
Thank you.